This is a Unit 4, Part 1 Diagram Exam Pronunciation Guide. Plasma. The formed elements include leukocytes, platelets, erythrocytes. The image shows platelets, neutrophils, a red blood cell, also known as an erythrocyte, a lymphocyte, a basophil, a monocyte, and an eosinophil. A multipotent stem cell gives rise to myeloid stem cells and lymphoid stem cells. The myeloid stem cells differentiate into erythroblasts, reticulocytes, and erythrocytes. Myeloid stem cells also differentiate into megakaryoplasts, which become megakaryocytes that break up to make platelets. Myeloblasts give rise to basophils, eosinophils, and neutrophils. These are all known as granular leukocytes, and they are white blood cells. Monoblasts give rise to monocytes. Monocytes have no granules and thus are agranular leukocytes. The lymphoid stem cells give rise to lymphoblasts and NK, which means natural killer, blasts. And lymphoblasts give rise to B lymphocytes, T lymphocytes, and NK, or natural killer cells. These four cells are agranular, meaning they have no granules in the cytoplasm. The heart. The left subclavian artery, the left common carotid artery, the brachiocephalic artery, superior vena cava, aorta, left pulmonary artery, pulmonary trunk, left pulmonary veins, right pulmonary artery, right pulmonary veins, pulmonary semilunar valve, left atrium, right atrium, atrioventricular or bicuspid valve, atrioventricular or tricuspid valve, chordae tendineae, papillary muscles, right ventricle, interventricular septum, interventricular septum, left ventricle, and inferior vena cava. Sinoatrial node, also known as SA node, atrioventricular node, atrioventricular bundle, both are abbreviated AV. The branches of the atrioventricular bundle, Purkinje fibers. These are all arteries, superficial temporal, external carotid, internal carotid, right common carotid, right subclavian, brachiocephalic, axillary, intercostal, deep brachial, brachial, renal, radial, common iliac, internal iliac, external iliac, ulnar, deep femoral, popliteal, anterior tibial, fibular, dorsalis pedis, posterior tibial, femoral, gonadal, inferior mesenteric, superior mesenteric, abdominal aorta, celiac, thoracic, descending aorta, ascending aorta, aortic arch, left subclavian, left common carotid, vertebral. These are all veins. Temporal, facial, internal jugular, right brachiocephalic, axillary, cephalic, brachial, basilic, median cubital, radial, renal, ulnar, common iliac, external iliac, femoral, popliteal, posterior tibial, small saphenous, anterior tibial, great saphenous, internal iliac, gonadal, ascending lumbar, inferior vena cava, hepatic, superior vena cava, left brachiocephalic, subclavian, external jugular.